Dr. Rob here, Facebook Live, 2 o'clock. We're going to talk about the effects of intermittent fasting. Without question, intermittent fasting has taken the world by storm. It was a conversation piece of 2018, and with all the New Year's resolutions of 2019 and my mantra that it's all about you, everybody's talking about intermittent fasting and how to lose weight and how to get healthy while you lose weight. Remember, intermittent fasting is not a short period of time that it's something that you do. Intermittent fasting is an addition to a lifestyle change. So before we even explain intermittent fasting, understand it's all about lifestyle. There's no short-term diets. They really don't work. No salt bath where you burn 700 calories. It's all about changing your lifestyle. And intermittent fasting, without question, is a great addition to getting healthy and changing your body composition, losing weight, getting your skin tighter, etc. Now, let's go through some definitions of intermittent fasting before we go through the whiteboard over here. Number one, intermittent fasting is really a popular term. It's the amount of time that you eat and don't eat. So the first number when you say an intermittent fast is the one that I really like is 12 and 12. So it's 12 hours of non-eating and 12 hours of eating. Whereas there's some others that are 16 and 8, etc. Now, with this whiteboard, there was some literature that just came out in Science Magazine back in November that we've changed a little bit because what we've done in our office with the intermittent fast is different than what they tested for. In addition, the term that I really like is time-restrictive feeding. Time-restrictive feeding or eating is similar to what I said in intermittent fasting. However, the time-restrictive feeding very simply says the time in which you can eat. So for instance, again, time-restrictive feeding may be 10 hours. So for 14 hours you don't eat, and for 10 hours you do eat. The reason we don't call it intermittent fasting as much anymore is because within the fast, there are some people who don't drink water, which is incorrect. And what we like with the time-restricted feeding / intermittent fasting is that we, without question, we don't want anybody not to eat during the day. We don't do that day or 2 days or 5 days where you do it. We intermittent fast as much as we can, time-restrictive eating as much as we can. There's also something called fast mimicking diet, which has been created by Dr. Longo. Great stuff. He'll be at IHS, Integrative Health Symposium, with me. So great time to check out all the different health practitioners talking about the different diets. But within that, it is a low amount of calories during the day for a 5-day period over 30 days, where you have the ability to fake your brain into think that you're fasting, but getting enough nutrients so you're really not that hungry. So we're really going to talk about intermittent fasting as a time-restrictive eating, and I'm going to go over some of the literature and all the good things that it does. A couple of real points why some people have done it on their own and not got the results that they thought, and I always recommend to come in, and I'll show you a couple of little tricks to the trade on that. If you have any questions, Stephanie's right there. She'll stop me. I'll answer the questions. Do me a favor. Share this. This is a hot topic. Like it. Comment. We'll do any shout outs as we go through this. So Steph, you're good. If anybody has a question, feel free to ask me a question. Say what you're doing. If you're busy, you see it later on Memorex as opposed to live, we will answer the question. So here we go. Number one, the positive effect of intermittent fasting. What's very interesting is your total caloric intake. That's something you can control. So there are multiple things that you speak about in overall lifestyle and things that will affect your body composition and your health. It is what you eat, also your exposure to food. So their exposures to food or your exposures to the environment. We try and deal with a better environment. Unfortunately, the environment isn't something that we can always control. Our genetics, even though we're not locked, is not something that we can control. Every one of us can control how we eat and the time frame in which we can eat, whereas the environments aren't as easy and our genetics aren't as easy, because if that were the case, I'd ask for LeBron James or Usain Bolt kind of genes to be athletic. With that being said, the intermittent fasting has positive effects on ketone bodies in the blood. Ketone bodies like acetyl acetate, and the big gold medal winner, beta-hydroxybutyrate. So when we intermittent fast, we're able to make ketone bodies. Beta-hydroxybutyrate has a great effect on overall health. Its effect on overall health is that it increases glutathione, great for the brain in increasing brain-derived neurotrophic factors. So What I like is if you're going to use a ketone or ketogenic diet / lifestyle, you definitely want to do that with what we call intermittent fasting. In any case, intermittent fasting makes the ketone bodies. It also increases the adiponectin levels. Those levels are critical because they help with blood sugar. By helping with blood sugar, they basically allow you to decrease your body fat levels. Great choice. By the way, for women, when you can increase your pH, you're also going to be able to have a positive effect on the adiponectin levels. Cortisol, unfortunately, in most instances, when people intermittent fast, cortisol really poses an issue because cortisol is a stress hormone, and when people fast or fasting correctly, not listening to Dr. Rob or other healthcare practitioners, their cortisol goes up, and that's the problem, and that's where they fail on the intermittent fast. So the literature showed that the cortisol goes up. The lab tests in the office when we intermittent fast goes down because we do it right, because too many people are doing 16 and 8, too many people are taking a day off, they're not doing it right. That stress hormone of cortisol, if it goes up, if you're not doing it right because you're doing it on your own and you're not really sure how to matriculate through the pathway, that cortisol will then increase your blood sugar. That cortisol level will give you that stress hormone, ultimately putting down fat. So you have to be careful. I did say it increased because the literature says that it does, but I wanted to say when it's done right and we use low glycemic index foods, real foods, and we do it on a 12 and 12 basis, no problems with cortisol. In addition, I also started Ghrelin. Ghrelin is a hormone, it's a brain hormone, Ghrelin means that you're hungry. Truly, in this literature that they saw, because they were intermittent fasting and taking a day or two off during the week of literally not eating, Ghrelin went up and made you hungry. In my office, I started again, Ghrelin goes down. Ghrelin goes down because the leptin, which you'll see later, goes up. Leptin is a satiety hormone. You feel full, and that's the way to do all these intermittent fasts. Remember, it's not about calories. When you intermittent fast, it's not a decrease in calories. It's a time restriction to allow your body to function better, to allow you to have what we call autophagy, 2016 Nobel Prize. Autophagy allows the cleaning of your cells, lets your cells to function better. It's not a caloric restriction. It's a time of restricting what you're eating, and we're always picking better foods because it's not about calories. It's all about chemicals. We don't want to eat chemicals. And it's all about satiety and nutrients. It's not about calories. So you eat a piece of bread, we don't even have to go through gluten. We know it's bad. There's no nutrients there. There's no satiety there. You eat an avocado, especially an organic avocado, there's a lot of nutrients, there's a lot of fat, there's a lot of satiety. Great example. Avocado versus sugar, etc. In addition, glucose goes down, your blood sugar goes down. Blood sugar may be one of the biggest markers for overall adverse health. Your insulin level goes down, your IG1 goes down, and your leptin levels, like I said, this was supposed to be up. Your leptin level should shoot over here doing it the Dr. Rob way. In addition, triglycerides go down, your blood fats, and your LDL levels. Not only do your LDL levels go down, your LDL small particle levels go down, which are really the problem in cholesterol, leading you towards heart attack. Inflammatory markers go down, inflammatory markers leading you towards cardiovascular disease. And C-reactive protein, which is a tissue inflammation marker, a critical element. Finally, when you look, that's in your blood. Liver. Your liver is making ketone bodies production. So the intestines and your liver make ketone bodies. That's increased. We talked about that before. That's a big thing. So once again, imagine how synergistic if you do the ketogenic diet right with intermittent fasting. So I just had an Instagram post that's sort of blowing up, and we talked about the ketogenic diet because it's, again, in the news. So many stars, Kardashian, Gwyneth Paltrow, and the like have done it. With this, if you do the clean keto versus the dirty keto, the clean keto, good fats. The dirty keto, really crappy fats, your trans fats, your French fries, your processed meats. So even though keto is 75% fat, it has to be good quality fats. You mix those with intermittent fasting and you've got a great lifestyle or diet for a new improved lifestyle. In addition, Insulin sensitivity goes up. That's a great thing because insulin or insulin resistance may be the worst marker for overall health. Now we've got a decrease in glycogen production, so you're not storing as much fat, you're not storing as much sugar, and a lot of people eat a lot of carbohydrates, get an enlarged liver or a fatty liver. You're not going to have that on a proper intermittent fast, if you will. The intestines, once again, make ketone bodies. Skeletal muscle you may not be able to see there, but it increases insulin sensitivity and the structure and function of muscles. So we've gone through halfway through. Here we're going to talk about the brain, and I think this is where the intermittent fasting really gets the bang for the buck, if you will. You get a great hunger response. You're not as hungry. You get that satiety. Huge takeaway. Have you ever noticed, I always use this as an example, eating a pizza pie? I mean, who in your right mind realizes you can eat a whole pizza pie? 2,500 calories. It's a lot of calories, 3,000 calories. Why? Because the pizza pie has what? Gluten, garbage, glue, we know that. Empty calories, cheese, sauce. It doesn't have anything of constitution. It doesn't have a lot of nutrients. It doesn't have any satiety. Yet I could eat an avocado and get fuller on the one avocado, I don't know, 400 or 500 calories max. 400 calories versus 2,500 calories. Why? No satiety. It's all about satiety, feeling of fullness. It's all about nutrients. It's not about calories, a plethora, a large amount of garbagey calories in that pizza pie. A lot has to do again with the signaling in the brain. In addition, intermittent fasting makes neurotrophic factors leading towards cognitive functions and decreasing stress resistance. These neurotrophic factors are things that work in the peripheral nervous system and the central nervous system. They make something called BDNF, brain-derived neurotrophic factors. These brain-derived neurotrophic factors allow for brain neurogenesis, so they allow for your brain to function better and for an increase in cognition. Fantastic. In addition, what happens is you have a decrease in inflammation and a decrease in oxidative stress if you follow this intermittent fasting. So cardiovascular system, your resting heart rate goes down, your blood pressure goes down. So many Americans are suffering from high blood pressure. In addition, pancreas, your insulin production goes down. We talked about insulin production and insulin resistance. Lower level of insulin production, lower level of insulin resistance. Big thumbs up towards health. And adipose tissue, your fat tissue. Your fat becomes more metabolic and your fat is able to burn fat. And again, you get the adiponectin production. Insulin sensitivity is good. And once again, we talked about the leptin. The leptin is truly increased. When leptin's increased, you get that feeling of fullness. You have less fat mass and less inflammation. So intermittent fasting, time restrictive eating is without question based on science. So everybody reads an article sometimes and just jumps into it. There's specific methods and what's best for you. So my 2019 mantra, my mission statement for 2019, it's all about you and what's best for you. So you have some questions on intermittent fasting and what's best for you, what time frame, what foods, what diet to mix it with. Feel free to reach out and talk to me. So Steph, do we have any?
You have a shout out from Gallegos Lupita. She says hello from Salinas, California.
Hola, how are you? How you doing? Happy you could hear from you. That's it? All right. Because normally we have a whole bunch of questions. Today we didn't get any intermittent fasting. I know that a lot of people are going to have a few. It's every Tuesday at 2 o'clock. Do me a favor, everybody. Like, share, comment. Take a look at my Instagram, Dr. Rob Silverman. And we've got our YouTube blowing up, Dr. Rob Silverman. Hope to hear from everybody really soon. Dr. Rob, always yours in health.